Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Hi viewers, I am inviting all of you to the health show Doctor's Voice. This is Dr. Nova along with you in world famous Parkway Cancer Centre, Mount Elizabeth Hospital, Singapore. We are here to keep you in good health. We are very happy to have Dr. Hui Ti, Medical Oncologist, Senior Consultant, Parkway Cancer Centre, Singapore. We will talk on breast cancer. Now we are moving to our main session. Welcome.
Thank you very much. How are you?
Greetings from SOTP Bangladesh.
How are you?
We will talk on breast cancer. At first, I want to know from you that what are the common female cancers?
I think all over the world, breast cancer is quite common, specifically so also in Bangladesh. But we're beginning to see more and more ovarian cancer and uterine cancer in Bangladesh.
In our country, as it is not aware to all of mass people, this is the reason, and we need to increase their awareness. That's why I was telling.
Cervical cancer has always been at the top, but we see more and more ladies being very aware, and therefore the chances of actually getting cervical cancer is on the decrease. It's just that with awareness, we're beginning to see more and more, but the incidences is not increasing.
Yeah, because it is preventable.
Yes.
And breast cancer, is it preventable?
I think there are many causes of breast cancer. There are some which are preventable, but there are definitely some which are not preventable.
And how can we diagnose at very early stage?
The best way is to go for screening and to be aware of the signs and symptoms of breast cancer. Very often we know that ladies have breast cancer, but they are not aware of the fact that breast lumps can be breast cancer, so they delay the diagnosis. So first of all, ladies must do breast self-examination because that's free and can be done every month.
And what are the symptoms?
A breast lump, or a change in the skin in the breast, or enlargement of the breast, or lumps that they can feel anywhere near to the breast that could be signs of breast cancer. But to find breast cancer earlier, especially for the slower growing cancers, it is better to go for once every year or once every 2 years mammogram when a lady has turned 40 or 50 years old.
And it is obviously to do the mammography. Mammography is very important. When and who will do that?
Ladies at the age of 40 years old can begin to do mammogram. Ladies who are younger than 40 years old, the mammograms are not as accurate because the breast is very dense because they are very young. So we advise ladies below 40 years old, if they have any concerns about breast lumps, to do an ultrasound of the breast instead of just a mammogram. But for ladies who are above 40, the older they are, the more accurate a mammogram is. Meaning, if we have a negative mammogram, it is likely that there is no cancer. So ladies above 40 should do mammograms and ultrasounds on a regular basis.
And how they can examine by themselves?
I think the easiest would be when they are taking a shower. With the soapy hands, they can examine all parts of the breast and the armpit area to make sure that they do not find any lumps or unusual skin changes.
We know about hormone replacement therapy. And is there any relation between hormone replacement therapy and breast cancer?
There is a very small relationship, and this relationship is not strong. However, in Bangladesh, we know that the causes of breast cancer is very, very unlikely to be due to hormone replacement therapy. The more greater risk is due to obesity and diabetes, meaning ladies who have got, when they reach their 40s or 50 years old, they've got very poor sugar control. With poor sugar control, their immune system is poor, and that allows them to get different types of cancer, apart from just breast cancer.
And is there any relationship, family history?
Most of the time we find that if we talk to a family, they will tell us that my auntie or my mother-in-law had breast cancer. But when we really talk about breast cancer in family, they would have to have more than one person very close to them below 40 years old to get breast cancer before we call it familial breast cancer.
And do you think that in the treatment process there is advancement from 10 years back?
Well, if we were to compare 10 years and 15 years ago, definitely there will be advances.
And,
but
what are those?
We're beginning to realize there are some breast cancers that do not need chemotherapy if in the early stages. And with newer chemotherapies and targeted treatment chemotherapy, we're seeing that patients with very aggressive breast cancer can now be cured. However, the stage is still important. The earlier the stage, the higher the chance of cure. Nothing, no treatment on this earth can be replacing the successful rate of cure if compared to, say, we were to find a breast cancer very early. So early detection is still the most powerful tool to cure.
And at what stage people usually come to you?
Ladies usually come to me from Bangladesh at the stage 2 or 3, which is still fairly advanced. One of these reasons is because we find a greater proportion of ladies from Bangladesh having the aggressive breast cancer, the triple negative breast cancer, the HER2 overexpressed breast cancer, where from the time of a breast lump to the time that the cancer begins to spread is only a mere few months. So this is the reason. We still encourage ladies to do a general checkup and to do a breast self-examination. The moment they detect any lump or changes in the breast, they must see a doctor.
And what is the reason behind this?
We believe it is due to the diet. The diet perhaps in Bangladesh may be quite high in fat, so that's one reason, and high in sugar and in fat. 40% of cancers can be related to the food that we eat.
So what type of food we should take?
Actually, mainly focusing on vegetables, lots of vegetables, cut down on sugar, cut down on oil, and usually cut down on processed food. Is to keep an ideal weight would be the best.
Dear viewers, now we will go for a short break. We'll be back soon. Please stay with us. Welcome back to the health show, Doctor's Voice. Thank you for being with us. What type of treatment you are providing right now?
I think basically the breast cancer treatment is very standard. But what we have here in Singapore and in Parkway Cancer Centre is that we make sure a patient has an accurate diagnosis. There are many different types of breast cancer. If treated differently and incorrectly, then the cure rate might be different. So there isn't a one-size-fits-all treatment. We try and give a patient a type of a personalized care. If they really have very early breast cancer and they don't need to have chemotherapy, we can do additional tests to reassure them that chemotherapy isn't beneficial. However, if they do have a breast cancer that requires to have long-term chemotherapy, then we need to tell them upfront so that they can prepare the needful in order to get the best treatment.
And what type of breast cancer you usually handle?
So for example, if we were to divide breast cancer into 4 types, there is the luminal A, which is a slow-growing cancer that tends to occur in ladies who are 65, 70 years old. These are very slow-growing cancers. They can be detected best by mammogram and ultrasound, and not so much by examination. We then see the luminal B, which is also hormone sensitive, but it tends to happen in younger ladies, 40s or 50s, or even as young as 35. And then we see a HER2 overexpressed breast cancer, which can be quite aggressive. And then finally is the triple negative breast cancer, which is also very aggressive. The latter two, the HER2 overexpressed and the triple negative breast cancer, they tend to present with breast lumps rather than mammogram findings. So breast self-examination is very powerful in picking them up early.
And when mastectomy is necessary?
Mastectomy is necessary if the tumor is too large compared to the size of the breast. If the tumor is, for example, 4 centimeters and the breast size is only 6 centimeters, then after doing a lumpectomy, the breast wouldn't look very pretty. So in those circumstances, we would advise the patient to do mastectomy. However, if we saw a patient who is keen to do breast conservation, we would recommend chemotherapy up front, giving the chemotherapy appropriately for the type of breast cancer in an attempt to shrink the cancer to the point whereby conservative or breast conservation surgery can be done so that the patient need not have to have a mastectomy. That is a commonly practiced in management of breast cancer here.
If you provide chemotherapy, then a lot of side effects arise. And how do you manage those side effects?
I think most of the side effects, 100% of the side effects, there is a medication for it. The one thing that we don't have a medication for is the fear of treatment. So 50% of the battle is fought if we don't fear too much about the treatment. Many ladies say, well, I'm afraid of nausea and vomiting. There are good medicines for that. They are very afraid of hair loss, but we do have a cold cap machine that can help patients. But we generally find patients don't mind having their hair loss after 1 or 2 cycles because new hair can grow out again. Tiredness, loss of appetite. Sometimes that can be managed by gentle exercises and reteaching a patient how to eat for nutrition rather than good taste. So very often we eat because we like to eat. High sugar, high salt, high fat. That's good to eat. But during chemotherapy, we lose the taste for that. So we don't feel like eating. But if we ask our patients to focus on the nutrition, not so much on the taste, they find that the energy they can get from simpler food, lighter food, salt-free food, sugar-free food can be much more than if we take something that is very strong in taste.
And what do you provide if mastectomy is done, then they psychologically become upset, and what do you do for them?
We try to see the patient before any surgery is done. If there is any breast lump, we would prefer to do the multidisciplinary management right from the beginning. We see the patient, we diagnose, we give them an understanding of what type of breast cancer they have with a biopsy. Then we recommend upfront 3 options: a mastectomy, a breast conservation, or reconstruction. Generally speaking, we find that ladies who agree to have a mastectomy, it is because they fear that with the breast conservation, they may end up missing a diagnosis in future. Now, some ladies have this thing called a multifocal breast cancer, meaning very small little bits of cancer, but in the whole breast, meaning the whole breast is diseased. So it is not wise to keep any part of the breast. So in those ladies, we recommend the consideration of a reconstruction, even from the word go, rather than to say, okay, we'll do the mastectomy first and then decide what we want to do later on, because that would not be very complete. Now, if a lady were to diagnose with breast cancer early, the first thing they will want to do is get rid of it quickly. But once we do a mastectomy, we actually can't put it back. However, having said that, we do see a lot of patients who have had their mastectomy before seeing us. With good counseling, good chit-chatting, we tell them actually a mastectomy, we teach them how to use special bras, special inserts for their clothing. After 1 or 2 years, they do come to terms with it and they're quite happy with the ultimate outcome.
And is there any provision for multidisciplinary care here?
Cancer is always multidisciplinary. I don't do surgery, I don't give radiotherapy. My radiotherapy doctors don't give chemotherapy, they don't do surgery. My surgeons don't give chemotherapy. We are always together. Yes.
Always together.
Yes.
And this is the holistic approach.
Yes, we also have a dietitian that helps us to teach patients how to eat well. We generally find that many of our ladies can make their health better by eating better. So instead of just getting very sick from the chemotherapy, if they follow what we teach them, they get rid of their diabetes, their blood pressure drops. But the problem here is that the food in Bangladesh is too good. So it's very difficult to follow our instructions on what not to eat.
Those are fatty foods.
Yes, fatty food, sweet food is too good.
Fatty food and sweet food we have to cut from our diet.
Yes. So we generally find that with the side effects of bad appetite during the chemotherapy, we actually find that many of our diabetic patients, the sugar controls becomes fantastic during the chemotherapy. But once the chemotherapy is finished, they have the appetite to eat, their sugar control goes haywire again. So during the chemotherapy, we try to teach them a long-term lifestyle change so that they can become healthier even after the chemotherapy has been completed.
And is there any provision for radiotherapy?
Yes, we do have radiotherapy in all 3 hospitals. Radiotherapy is useful for certain circumstances. If a patient had a breast conservation, they would have to have radiotherapy. If a patient had a slightly higher stage, or stage 2B or stage 3 breast cancer, they would benefit very much from radiotherapy. So that's part of the program.
Dear viewers, now we will go for a short break. We'll be back soon. Please stay with us. welcome back to the health show Doctor's Voice. Thank you for being with us. When we feel that there is a lump in the breast, and instantly what to do?
First of all, is not to panic. The second thing is to get an ultrasound and a mammogram to see if that is truly a lump. We sometimes see patients who complain of a lump, but when we actually examine them, it is a skin tag. So it is not inside the breast, it is on the outside. So that's the first thing. The second thing is to get a biopsy to confirm that, because up to 30 to 40% of breast lumps are not malignant. They are benign tumors due to hormonal changes during puberty or during menopause.
And if it is untreated, then what can be, is it possible to turn into malignancy?
If it turns out to be a fibroadenoma, which is a benign condition, it doesn't turn into cancer. But fibroadenomas can be associated with cancer, meaning if I have a fibroadenoma, on the side of it, there might be 5% chance of having a cancerous lesion at the same time. So it is important for us to exclude it. But if a tumor is benign, it would always remain benign. If it was cancerous, it can enlarge and it can change from something that is not so aggressive to something that spreads. So when we see a breast lump, it is important to make sure that this is not cancer. But benign lumps do not become cancerous.
If it is not painful, people usually don't come to a doctor. And which one is painful and which one is painless?
A breast infection or a mastitis is usually extremely painful. The more painful it is, the less likely it is breast cancer. But generally, a small lump, they will not have any pain. Sometimes we see patients who wait for a very long time till their painless lump become extremely painful. That's when the cancer has already spread.
Is there any relation with ovarian tumor with breast tumor?
We find that about 10% of patients with breast cancer has a risk of ovarian cancer. Fortunately, only 2.5% to 5% of ladies have this genetic syndrome called BRCA, or what is otherwise known as the Angelina Jolie gene, where ladies who have a very high risk of breast cancer and ovarian cancer. Fortunately, that is rare. But ovarian cancer, on the other hand, is also on the rise in Bangladesh.
And what is the reason?
Again, similar to Singapore and similar to all over the world, we believe that it is due to two reasons. Number one, generally speaking, ladies are having less children. And number two, generally, again, there is an increase in the fat intake and sugar intake. So obesity itself is also a relation to ovarian cancer. So that's all over the world. It's not confined to just in Bangladesh.
So if someone has ovarian cancer, she needs to think about breast cancer?
Actually, the ovarian cancer is what is more concerning compared to breast cancer. Breast cancer is highly curable. If we find it at the early stage, even if it has a stage 2, the chances of cure can be higher than 90%. So breast cancer is not always the problem. With ovarian cancer, on the other hand, it can be considered as a fairly aggressive type of cancer. If we find it at stage 3, the 5-year survival is only 50%. So it's important to pay attention to the ovarian cancer. With ovarian cancer, one problem that we have is that there are very few signs and symptoms at the beginning. We find that ladies can only come and ovarian cancer can only be diagnosed when it's at stage 3 because they are unaware of the signs and symptoms of ovarian cancer.
Okay.
Now, with ovarian cancer, a lady may feel bloated, uncomfortable. They might feel that their clothes are feeling tight. They may feel that they're just putting on weight. But in actual fact, this very rapid increase in the tummy could be actually underlying an ovarian cancer. We advise ladies with family history of ovarian cancer to go for regular screening with ultrasounds of the ovary and a CA125 examination. But we can only recommend that for ladies who are older, above 50, or at best, those who are postmenopausal. Because in premenopausal ladies, CA125 is not so accurate because it may mean menstruation, it may mean fibroids. But for ladies who are postmenopausal, an abnormal CA125 is very powerful in detecting ovarian cancer.
You have provided a lot of time for us, your valuable time. We took your valuable time. Thank you so much. Thank you for everything.
Thank you very much. Thank you.
Dear viewers, we are at the end of the show. See you in the next episode. Till then, stay well and keep your eyes on ACTV. Take care. All the best.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital would put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spent no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing, so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex and difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. We have the best of the best working in this hospital.
The clinic's actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile. That's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course, selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products, but it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.